Welcome, everybody. We'll give a couple of minutes as people are joining into the event today. Thank you for joining us. We apologize for the delay. We were having a little bit of technical difficulty, but I think it has been resolved now. So hello, my name is Amanda Newberian, and I work as the Operations Manager at the Canadian Institute for Public Safety Research and Treatment, which is CIPSRT. Welcome to today's presentation, PSP Moral Injury and Coping During COVID-19. Before we get started today, there are just a few housekeeping items that I'd like to go through, which are on the screen for you as well. All attendees are in listen-only mode to limit feedback and noise. Today's session is being recorded, so you'll be sent a copy tomorrow. That way, if you miss anything, you can watch it again. This GoToWebinar launch window sometimes is blocked by some organizations. So if you are having trouble hearing or seeing the presentation, you may have to join us by phone. I know that's on the screen as well. I hope that you're able to get that message. Time permitting, we will respond to some questions at the end of today's session. So you may submit your questions through the question box at any point throughout the session, and we'll address those, again, time permitting, at the end. So I'm pleased to introduce our presenters for today. Dr. Kim Ritchie, Assistant Professor at Trent University, and Mauda Karram, Clinical Research Assistant at McMaster University. Welcome, and I will change presenters. Just one moment while we get the slides up. Perfect.
Okay, are we set to begin?
Yes.
Wonderful. Thank you, and thank you so much for inviting us to be here today. It's a real pleasure to be here with you all and to be part of this town hall. I'd like to begin our presentation today by acknowledging the land on which McMaster University is located, which is the traditional territory of the Haudenosaunee and Anishinaabe nations, and within the lands protected by the dish with one spoon wampum belt. That wampum uses the symbolism of a dish to represent the territory, and one spoon to represent that the people are to share the resources of the land and only take what they need. We seek a new relationship with the original peoples of the land, one based on honor and deep respect. May we be guided by love and right action as we transform our personal and institutional relationships with our Indigenous friends and neighbors. It is in the same spirit that I welcome you all to our town hall on Canadian public safety personnel's experiences of potentially morally injurious events and coping strategies during the pandemic. Next slide, please. Over the past 2.5 years, we've really heard a lot about the strain of the pandemic on public safety personnel. And during that time, it's been a real privilege to be part of this amazing team of researchers and collaborators who've been working on this project to learn more about the experiences of public safety personnel who have served on the front lines throughout the pandemic. I'd like to take this opportunity to recognize and acknowledge our entire team who's have really contributed so much to this project. And I'd also like to acknowledge and give thanks to all the public safety personnel who, despite facing really difficult circumstances over the pandemic and in their daily lives, still found the time and the courage to talk to us and share their experiences. Next slide, please. Thank you. So today we have 3 objectives. The first is to understand and identify types of potentially morally injurious experiences that have been described by a select group of public safety personnel occupations during COVID-19 pandemic and their associated psychological outcomes. Second, to understand the types of coping strategies described by public safety personnel that they were able to make use of and that were not accessible to them. And then lastly, to be able to acknowledge and reconcile identified barriers to coping when considering resources developed to support public safety personnel. So first we'll start talking about moral injury, and then we'll lead into talk more specifically about some of the work we've been doing in our research lab over the pandemic. And when we think of moral injury, we think of moral injury in terms of this profound psychological, emotional, and spiritual distress that can arrive in the aftermath of situations when one feels that their morals or their ethical beliefs have been violated. And more specifically, moral injuries thought to occur as an outcome following exposure to one or more of these potentially morally injurious events, or PMEs for short. And PMEs are also conceptualized to occur in a few different types of situations. So first, when there's a situation when a person's actions or inactions transgress or violate what they consider to be their moral code, or where they may witness the actions or inactions of someone else that they feel also transgresses their moral codes. So an example of this could be where a police officer may have to remove a child from their home, but the officer personally believes that the situation doesn't warrant it. So there's a difference between your personal beliefs and values and what your actions are, or that you're being in a situation where you have to do something that transgresses those actions. And then the other type of PME that we think of is in situations where the individual feels a sense of betrayal. And this can be by an individual or by an organization that they believe has a duty to care for them and also for others. And it's really important also to mention here that not everyone who experiences a potentially morally injurious event will go on to develop moral injury. But for those who do, moral injury is characterized by a number of consequences, including elevated levels of arousal, feelings of guilt and shame are commonly associated with it, and also anger. And although moral injury is not considered a mental health disorder in the DSM-5, it has been linked with a higher risk of developing a number of specific mental illnesses, such as post-traumatic stress disorder, depression, and anxiety disorders. And importantly, there's been a very few number of studies, but the ones that have been done have shown that public safety personnel are at increased risk of moral injury due to high occupational exposure of these types of PME situations. So during the pandemic, public safety personnel have served on the front line. And they've really faced a number of new and very challenging situations. So some of those situations that we've heard of are increased risk of contracting COVID-19, and importantly, then potentially transmitting it to their family and to their friends. They've really had to adapt to these ever-changing policies and protocols, changing daily, hourly at times. And these practices and protocols govern their work and are very difficult to keep up with and to understand what changes are being made and how that changes their work on the front lines. And then the other situation we've heard a bit about is that a number of public safety personnel have had to enforce controversial public health measures that were intended to reduce the risk of reduce the spread of infections, such as lockdown restrictions and border restrictions. But despite this, these really important rules, we really have had very little research done on the impact of COVID-19 on the mental health of PSP. So the studies we'll be sharing with you today are part of a larger project that we've been doing in our lab, where we're examining the impact of COVID-19 on the mental health and functioning of public safety personnel in Canada. And the first study we'll be sharing today, we look specifically at the types of PMEs described by public safety personnel And we wanted to understand what were those types of PMEs, and also what are their psychological outcomes. The second study that we'll be sharing today will be shared by my colleague Mauda, and she will focus on how public safety personnel coped with this increased stress during the pandemic. So for the larger study, we focused on 6 specific public safety occupations: public safety communicators, correctional officers, paramedics, border patrol, firefighters, and police officers. And the reason we chose these occupations were that they were most involved in the pandemic response. We sent recruitment posters throughout Canada, through public safety occupational groups, and also through a variety of social media channels. And in terms of the options, the participants could choose to participate in an anonymous online survey only, or they could participate in a survey along with a virtual semi-structured interview. So overall, we had 39 public safety personnel who chose to participate in an interview. And of this group, they were mostly firefighters, paramedics, and correctional workers, with much smaller numbers of police officers and public safety communicators in the other category. And the age range of participants was fairly evenly distributed, although most of the participants were from Ontario. So turning to the first study that we'll talk about today, for this study, we're focusing on the interviews and the types of PMEs. And in this interview, one of the interview questions we asked participants was to tell us a little bit about what they would consider to be their moral and ethical values. And you can see from the brief quotes on this slide, most of the participants we spoke with shared that their values were to serve the public and their team, to act with integrity, authenticity, honesty, and really to uphold individual autonomy. We then asked them to share with us instances during the pandemic that violated or transgressed these values and beliefs, and then to share with us what they felt were the impacts of these events on their psychological well-being. So now I'll share with you the results of that thematic analysis. So overall, in terms of the types of situations that transgressed their moral and ethical values, our analysis found these following contextual levels: person-related, team-related, organization or system-related, and public-related. And now in the next number of slides, I'll go on to describe each of these themes and sub-themes in a little more detail with a quote to illustrate the theme. So under the person theme, the first sub-theme was mostly found in police officers and really reflected their role during the pandemic of having to enforce these COVID-19 restrictions like mask orders or even stay-at-home orders during lockdown periods. And in many of these situations, the participants told us that they felt that these restrictions went against their personal beliefs generally, and secondly, they didn't feel it was their responsibility to enforce them. Yet they felt forced to carry them out, whether they believed in it or not. And as highlighted in the quote that is on the slide, what participants said is that they had this tension between what their personal beliefs were about having to enforce those orders, but also this tension between feeling that they had to carry out the order. And what they did is they developed a number of workaround strategies so that they, such as delaying enforcing these orders or avoiding enforcing these restrictions in order to be able to align within their personal values. Next slide. And in the second sub-theme, this sub-theme describes a number of situations in which COVID-19 protocols actually caused harm to people. And this quote on the screen was from a paramedic, and what they shared with us was during the pandemic, Many types of situations occurred that caused harm to people, but one of the ones we've heard quite a bit about was that you would arrive at a call, a paramedic would arrive at a call, or even other PSP occupations would arrive to at a call to help with the public, and they had to put on full PPE. So that would consist of, gown, gloves, masks, visors, etc. And that the additional time it took to don all these layers of PPE, unfortunately, the patient in this situation suffered a cardiac arrest. And in this example, the paramedic talked about their moral dilemma of having to follow the protocols, to take the time to don all these layers of PPE, when they also felt they had a moral obligation to provide life-saving care to the patient. And the way they described this situation was they felt they were caught between a rock and a hard place. And the way they described this was that they had an obligation to uphold the protocols that were intended to prevent or reduce the transmission of COVID to the greater public and also to themselves, but they also had a moral obligation to care for the person in front of them. But most importantly, they really didn't have a way to resolve this tension. So in the last example, they talked about workaround strategies. In this example, they really were left with this idea of being caught in the middle with no right decision. And so they said that they would just go on call after call with this tension unresolved. Next slide. Turning to the theme for the team level, the first sub-theme was reported by several of the public safety occupations in our interviews. And they shared with us that they felt there was a significant tension amongst their teams that developed over the course of the pandemic.
Oh, we seem to have a internet cut out, perhaps. We'll maybe wait a moment and see if she gets back here with us.
Before.
Kim?
Yeah.
Your audio had cut out there for the last minute or so. Are you able to just backtrack to where you were?
Oh, I'm so sorry. Can you hear me now?
We can hear you. Your image is frozen. I wonder if maybe you could consider turning off your camera and we'll see if that helps.
Yeah, absolutely. Let me try.
Thank you.
Okay, is that any better?
I do hear you, yeah.
Okay.
Thank you.
Is my camera off okay though?
We could try putting it back on and see if that's okay. It might have just been a temporary glitch in the internet.
Okay, I'll try it now.
Yeah, you seem okay now. You're not frozen anymore, so we'll proceed until something else happens. Hopefully it doesn't.
Hopefully it lasts.
Yes.
Thank you. So I'll just start over then and share this slide again, and hopefully that will cover off anything I've missed. So for this theme that we're talking about now is the team level. And what we were sharing with this slide is around the amount of tension that developed over the course of the pandemic amongst team members. And most of the time, this was due to strong opinions around masking and vaccines. And what we heard in our interviews was that these differences in opinions really changed how participants viewed their team members, and ultimately ended up polarizing teams to the point where the participants said that they perceived their team members could no longer be trusted to have their back, and that this really ultimately fractured many of the teams, and they really weren't functioning as well as they did before the pandemic. And in this quote on this slide by a firefighter, he talks about how his co-workers not masking and how this transgressed his fundamental values, or what he considered to be his fundamental values. And he went on to explain that it wasn't so much that he was concerned about any risk to his own health from not masking, but it was more of a violation of a personal value of doing what he believed was the right thing to protect others. I'll just check in. Is my audio still okay? Yeah. Okay, perfect. The next sub-theme at the team level was a number of participants described situations involving inappropriate or unprofessional conduct among colleagues. And for the most part, these instances were really contextually situated within the challenging work demands during the pandemic. So, as we said before, rapidly changing protocols, increased workload, which made it really difficult to keep up with many of the normal requirements. So in order to meet these regulatory requirements, participants shared with us instances where their colleagues changed or falsified their documentation to avoid becoming reprimanded. And in these situations, participants said that there was this tension between their values of wanting to support their colleagues and feeling obligated to support their colleagues and their team, but upholding their moral and ethical obligation to report any types of what they considered to be unprofessional conduct. And moving to the organizational theme, there was a number of situations shared with us that participants believed that their organization or leadership didn't prioritize their safety and well-being during the pandemic. This quote really highlights that some of these situations involved work conditions. And in this particular quote, the participant talked about excessive overtime during the pandemic and how this was perceived as not valuing the well-being of public safety personnel. Other participants shared with us situations where they didn't have adequate PPE. And this, of course, was in the beginning of the pandemic where PPE shortages were widespread. And still others reported situations where they felt that their leaders or even the organizations didn't support them when they went to them with a mental health concern, or they didn't receive adequate support when they went with a mental health concern. And the commonality in all these situations is that the participants reported that they believe that their organizations has a duty to care and protect them. And when this didn't occur, they were left with a sense of betrayal or lost in trust in the safety and of their safety in the organization and in their leadership. In this theme here, this next sub-theme really reflects many of the new protocols that were developed during COVID-19 that were intended to protect public safety personnel and also the public from a transmission of COVID-19. And most of these were focused on restrictions on performing procedures that would generate respiratory aerosols. And if you recall a couple slides ago, we talked about how that participants talked about this moral obligation to uphold new protocols, but also this moral obligation to care for the individual in front of them. And this one is at the organizational level, but it's also an overlap with that theme where participants told us that if they went ahead and broke the protocol in order to prioritize and care for the person in front of them, they felt there was consequences of being reprimanded by their organization. And in this quote, the paramedic shared that he had performed an aerosol generating procedure in order to provide life-saving care for a patient, but then was disciplined for doing what he perceived was best for the patient. And so again, there's this differences between doing what he felt was right and aligned with his personal values, again, with the tension of having to uphold protocols that go against those very same values. And the last sub-theme at the organizational level was focused on gaps or inadequacies in the system. And many of these existed prior to the pandemic and weren't that they were new situations. It was more that they were amplified over the course of the pandemic because of the number of people that required medical care and hospitalization, and really exposed a number of the gaps that were already present. In this particular example of the code on the screen, the paramedics shared a lot of system level problems that they saw when they were called to transfer frail elderly patients from long-term care to hospital for an acute care issue. And what they said is they witnessed that many long-term care residents had COVID, or they felt were high risk of contracting COVID in long-term care due to the close living environments. And they talked about, again, this obligation that they felt towards the residents, but they felt unable to adequately help them due to the gaps that they saw. And from that, they described this feeling of helplessness and sadness, knowing that these elderly people were vulnerable and high risk, but they felt unable to help them in that situation. And now turning to the last theme is the public theme. And this sub-theme is also similar to the team situation around polarized opinions on masking and vaccines, where there was also these divided and polarized opinions in the public over masking and vaccines. And this, of course, was in the latter part of the pandemic and was really felt by the participants we talked to be another type of transgression of their moral values. And in this particular situation, what participants said is that they talked about the sacrifices they had made during the pandemic, including, as we said before, a lot of working overtime under very challenging circumstances. Also, their families made sacrifices for them working overtime. And this was perceived when, in this situation, they perceived that the public also had a responsibility to make some degree of personal sacrifices. And if this didn't happen, it really sort of changed how the public safety personnel viewed the public. And in this example, many of the participants we spoke to talked about this loss of faith in humanity, where they didn't feel that people were taking care of each other. And it was the way they talked about it was almost as a betrayal of the public, who weren't willing to do their part to help each other out during the pandemic. And in the last sub-theme, this is similar to the one before, but this one was more directed towards public safety personnel, where they felt that the public actively disregarded their own well-being of the actual public safety personnel and of others. And in this quote, the paramedics shared with us that many times people would call 911 and tell the dispatcher and paramedics that they were COVID negative when they were in fact COVID positive, putting the public safety personnel at greater risk and their family and friends and the greater public by extension. So similar to the previous slide, this again goes back to that sense of the loss in faith in humanity and a really sense of a broken relationship with the public and a betrayal by the public. So the last thing that we asked participants was to talk about the impacts of this experience on their psychological well-being. And this slide shows very briefly a few of the quotes that were shared with us. And by and large, in most instances, they talked about anger and frustration was the most common response to these situations. And we really felt this was interesting because going into this study, much of the literature about moral injury and about PMEs talks about guilt and shame. But we really found that the majority of the public safety personnel we talked to talked more about anger and frustration. And at the first part, when we first started to experience this, and this was back in June of 2021, we thought maybe it was just that anger was a more accessible emotion. But over the course of the interviews, it really became a predominant pattern. And what we think might be happening, or what we sort of hypothesize and wonder about, is that since most of the types of PMEs that were talked about in our interviews were more the betrayal-based events than the transgression of actions of self, we wonder if that might be more of the outcomes is around anger and frustration instead of guilt. And there's actually been more literature in the last number of months that have also been reporting similar types of findings. And this has important treatment implications, of course, as time passes and we start developing more treatments for moral injury, where there's the targets would be more along the lines of anger and frustration rather than guilt and shame, which is more commonly associated with moral injury. So that summarizes the first study, and I would like to now turn things over to my wonderful colleague, Mauda Karram, who will be presenting her study on coping.
Thank you so much, Kim. So I would like to turn to our second study here in understanding how public safety personnel have coped with stress during the COVID-19 pandemic. So amongst many other questions, we asked public safety personnel, some people use various types of coping strategies when they are experiencing stressful situations. Have you used any particular strategies to help you cope? So after analyzing the interviews through our inductive thematic approach, these were our findings. Overall, we have this theme on the left, which addresses the changes in relationships among coworkers, and this theme on the right, which will speak to how public safety personnel responded to restrictions in their personal lives. So one way that public safety personnel coped during the pandemic was through social support derived from their coworkers. Coworkers helped public safety personnel navigate the stress associated to responding to emergencies, all while taking the necessary precautions to decrease the risk of contagion. Given that public safety personnel had these shared experiences and that the nature of these experiences were ones that many would not share with their families due to the fear of traumatizing them, public safety personnel found ways to support each other. One of the main methods was through dark humor, also referred to as gallows humor. This was something public safety personnel described to be shared almost exclusively with one another. And as you can see in the quote on the screen, many people not engaged in this type of humor may think of it as insensitive. But to public safety personnel, it's not. This is a way to make light of otherwise extremely challenging scenarios, and in some ways, as some public safety personnel described, a way to relay their pain. Now, although in some ways public safety personnel were able to maintain these bonds with their coworkers, many also spoke about this fracturing or dissolution of teams during the pandemic. In the quote on the screen, the participant speaks about hugs and handshakes as forms of not only connections with one another, but as a means to make sure colleagues are okay and fit for duty. These forms of deeper connection to one another were lost during the pandemic. Similarly, public safety personnel were no longer able to bond with one another. So there was no longer the skill training together, using on-site gym together, and this contributed to the perceived loss of the brotherhood, sisterhood that public safety personnel described. Furthermore, politicized views also influenced these feelings of distrust and betrayal between public safety personnel and their teams. So these discussions about mandates and restrictions created a divide between teams, where one public safety personnel actually described a scenario where one whole fire team was anti-mandate and another whole fire team was pro-mandate. And so, in this context, many public safety personnel spoke about vaccines and masks and social distancing as a means to protect one another and feel safe and supported by one another. And these feelings went deeper than that, as others spoke about trust and the question as to how they could trust a team member to, for example, pull them out of a fire if they could not trust their colleagues were taking the measures to protect them from the virus. So moving on to our second overall theme of responding to restrictions, safety measures and restrictions during the pandemic greatly impacted public safety personnel's ability to cope. Across Canada, there were varying stay-at-home orders, lockdowns, closures in effect that impeded access to many strategies that public safety personnel would usually engage in, such as gyms, sports, church, personal hobbies. Even further than that, there were many lost connections with loved ones. They couldn't physically see their loved ones, and even if they lived with loved ones, many would choose to self-isolate or would even be working way too much to cross paths. And there were even times where restrictions would partially lift, and many public safety personnel described that their loved ones would still choose not to see them due to fear of infection. So through our interviews with public safety personnel, it was made clear that there was a great toll taken on home life during the pandemic as well, where home life was usually a source of social support and a means to decompress. As public safety personnel would face challenging scenarios and increased stress at work, many described negative impacts on their home lives. So with increased hours and decreased mental bandwidth, these contributed to tension and conflict with family at home. Stress levels were high, and this impacted entire family units for those who resided with their families. Further, some public safety personnel felt that their families had stopped supporting them during the pandemic due to politicized views, or even described a lack of support for their profession during these times. So to combat the impacts of changing relationships, safety measures and restrictions, and relationship tensions, public safety personnel had to adjust their coping strategies to those that could be performed alone or in isolation. So for some, this meant seeking out desirable, proactive ways to cope, where others felt unable to access or use their desired coping strategies and felt they had to resort to undesirable or last resort solutions. So looking at the proactive or desired strategies, oftentimes this encompassed things like establishing routines, taking up new hobbies, and finding new ways of incorporating previously effective coping strategies, such as replacing gym time with long hikes. So in the quote on the left, this paramedic talks about how effective the routine of walking to the lighthouse and reading a book by the ocean has been in relieving stress. Turning to the last option, or undesired coping strategies, public safety personnel described examples such as using medications, hiring dietitians to reconcile bad eating habits, self-isolation, and even working more hours or calling in sick to shifts. So with this quote on the right, this individual felt that they had lost all of their means to cope, and understandably, it was difficult for them to reconcile these feelings of having nowhere or no one to turn to. Reluctantly, this corrections officer had to turn to medication. Now, before we sort of conclude here, I did want to point out something that stood out during this analysis. Overall, there was little to no mention of public safety personnel seeking out or receiving formal mental health supports. Now, as researchers, we can posit that this could be due to various reasons, including stigmatization, lack of access, or that supports may have been available but were potentially inadequate or simply not the type that was needed. Next slide, please. Thank you. So kind of going over our key findings for today, public safety personnel reported a range of potentially morally injurious events endured during the COVID-19 pandemic, which were experienced at multiple levels: the person level, team level, organization or system level, and public, all of which intersect and overlap. And notably, the majority of potentially morally injurious events originate from the organization and the system, which are experienced as deep betrayals resulting in anger and frustration. Overall, there is an urgent need to support the mental health of public safety personnel so that they can not only have tools to support themselves individually, but to also be supported by their teams and the organization. And with that, I'd like to thank you for your time being here today. We'd like to open up the chat feature for any questions. We'll try to address as many as possible, time permitting, possibly group together some similar questions. And before we kind of kick it off with the questions, we are still recruiting participants for our study. So on the slide, you'll be able to see the link to participate, as well as our study email for any questions that you have.
Thank you so much to you both. This has been wonderful. Yes, so feel free, everybody, to type in your questions in the chat, or sorry, to the question box. And Jane on our team here will forward them for our presenters. Just give everybody a moment to type your questions. I know that can take some time. What an interesting topic, moral injury. This has been really informative. I think some questions are coming in. I'm seeing them now, so they'll be they'll be coming to you right away. So I see a few coming in now. Are you able to see those, Kim and Mauda?
Yep, they're just popping up now. So, okay, this is great. So there's a question here about how, oh, sorry, keeps moving. How this is being used to propel solutions forward. How this information that we're presenting can propel solutions forward. And that's a great question. I guess, you know, in terms of the types of potentially morally injurious experiences that we talked about today, I think, you know, by understanding what situations are causing could cause moral injury and could cause the level of distress that we're talking about, I think that's helpful information to prevent these situations from happening if that's possible. So, you know, just being more aware of the types of situations, I think, can lead to those types of discussions about if they can actually be prevented. But I think there's a number of these situations that may not be able to be prevented. They just are part of the job. They're inherent with the job and they can't be fully prevented. So there might be opportunities then for discussions about, you know, is there ways to mitigate or reduce some of these situations? And then the other way, of course, is to better support with early intervention or put supports in place if there's situations that you know already that can cause moral injury or the potential of moral injury to occur. So I think those are the sort of the three areas that come to mind in terms of how can we use some of this information moving forward. But I think there's going to be a lot more ongoing discussions too. And I do think there's just the greater awareness amongst organizations on moral injury and on these types of situations that could result in moral injury is helpful for, you know, developing policies moving forward and protocols moving forward. That also comes to mind as probably very helpful.
Thank you, Kim. I do see another question here in the chat as well regarding stigma and seeking help for stigma within the seeking help for mental health within the workplace. And so the question reads, how can organizations reduce stigma for seeking help? And so I believe, through our research, what we've heard from public safety personnel and through research from previous reports, there are ways that an organization can play a role in normalizing seeking mental health support. And I can come up with a few examples here. For example, offering mental health literacy to employees, spreading that education, normalizing, what symptoms come up when we think of, struggles that happen at work, and also encouraging the use of mental health supports amongst one another, coming from the organization, leadership, and even within teams. And also, it could even be asking public safety personnel what they would like and what would help them feel supported. And for organizations to also, try and go through with that, within their means, of course. Yeah, those are just a few examples.
That's great, Mauda. I also see another question here about what will happen with the results of this research. So thank you for asking that. There's a number of things. So as we said, we're still recruiting. So we're still doing data collection right now. And then what we're planning to do is to develop a number of resources. So the first thing we're looking at is to develop some videos. And these videos will be featuring public safety personnel who are comfortable to tell their stories and talk a little bit about what their experiences during the pandemic are. We also are looking to host a symposium in the future where we can have some research presented and also some frontline public safety personnel also to talk about their experiences. And the hopes of all of that is to raise awareness amongst the public at large, amongst public safety personnel and their families and also organizations, and to start looking for ways that we can better support them as they recover from the pandemic and also from the number of challenges that they have faced. Okay, sorry, I'll just see if I can find another one here. I see a note here about time off. That's really interesting because there were so many of the interviews that talked about time off, and not just a few hours, but long periods of time that are needed between shifts to recover physically and mentally and emotionally from the type of work that they're being exposed to and the types of situations in their work. And a few people, in fact, said that was the difference in the pandemic for them. So that during the pandemic, because of the types of social distancing that had to be done and the changes in workload that people were faced with, there were sort of two camps. In some PSP talked about how the pandemic had a positive impact on their work schedule, where because of social distancing, they were now working longer periods of time and hours, but then they would have many days off in between for the next shift, and that had a really positive impact on their mental health by having that break in between. Whereas others talked about the overtime and how that had such a detrimental effect on their mental health because they didn't have that break in between. And so there was, in both camps, there was that sense of that break is really, really important for mental and physical health and recovery time. So we haven't looked into that specific issue in more detail than that, but it certainly came out time after time as a really important factor. And I think definitely needs to be looked at a little bit more.
Great, yes, we do have time for one to two more questions.
Okay.
Thank you. I do see some people sharing from their own experiences also in this question box. Thank you for being willing to, share. And, we hope that the presentation findings did resonate with many of the public safety personnel in the audience. And And we're just so glad that you're able to, share your experiences with us as well.
Yes, definitely. Support from leadership. That is something that we're going to be looking more into as we move forward with our interviews. But I think it's something that I hear leaders really saying, how can we help people more? We know that people need help and we want to help, but how can we do it? And we hear from the front line wanting help from their leaders as well. So there seems to be this need to repair some of those the distance that has been created or even amplified over the course of the pandemic, and that coming together to understand and to heal some of those broken relationships amongst the teams and amongst the leadership and frontline. And I think that's going to be an ongoing process of trying to understand each other's side of what happened during the pandemic, what happened in leadership and what happened in the frontline. And I think that might, start to get some of the talking to start repairing some of those relationships. But I think that is going to be a big challenge that is in the future that we're going to be facing, is how do we start to heal some of those relationships. There's a question here about the types of support for leadership. So I think the types of support, the biggest thing we heard about is being heard, being listened to, and being seen. And so that idea of, that I have an issue that I want to talk about. I want you to be aware of my experiences during the pandemic, what has happened to me, what I have done, what I have sacrificed, and how all of these things have impacted me. And I think just that idea of being validated in there to say, that has been a really hard time, will go a long way. But the types of support that people talked about are really along that line of just communication and being heard and a greater awareness of what happened on the front lines. I don't know, Mauda, was there anything in your side that came out about that you wanted to share?
With leadership, particularly, I would add and kind of touch on the importance of the communication and transparency and being visible to one another to kind of increase that trust amongst each other was another one too.
Excellent. Thank you so much. I know we did receive, unfortunately, we don't have time today to get to all of them, but as is on the screen, there is information on how you could connect further with this. So I just want to thank our presenters today, Dr. Kim Ritchie and Mauda Karram, as well as everyone in our audience for joining. This has been a really great session, and I appreciate all of your time. There will be a quick survey at the end. So once we close the survey, then it will pop up on your screen. So if you could just take a moment to complete that, it would be really, really helpful for us. CIPSRT hosts monthly town halls on topics specific to public safety personnel. So if there's something you'd like to learn more about, please let us know in the survey. Our next town hall is scheduled for April 11th, and the details are just being finalized, but they will be shared as soon as possible. We hope you'll consider joining us for that session, and the link to sign up it will appear in your email that you receive tomorrow with the video recording. So once again, I just want to thank everyone for attending today, and take care. Have a great rest of the day. Bye-bye.
Thank you very much.
Thank you.